Is it healthcare deal make or break time? The Prime Minister has invited the premiers to Ottawa for a healthcare meeting on February 7th. The big question, will this be the meeting to bring together a healthcare deal to bring it over the finish line? Let's bring in the front bench panel to weigh in on that. Joining me this evening, CTV News' Parliamentary Bureau Chief Joyce Napier, former Chief of Staff to Jim Carr, Carleen Varayan. She's an Associate Vice President with Summa Strategies. Former Alberta MLA and Cabinet Minister Gary Marr is here. He's the President and CEO of the Canada West Foundation. And former Communications Director to Jagmeet Singh, Melanie Richer. She now works at Earnscliffe Strategies. Hi, everybody. Strategies, rather. Good to see you this evening. Carleen, I'm going to start with you. I feel like a week ago, everyone was like, it's coming in a few weeks. And then the interviews I did today and the other things I've heard, it's like, okay, there's actually nothing concrete on the table at this point. Do you think, though, there will be on February 7th and it'll be a quick jaunt across the finish line after that?
I don't think it's ever necessarily been a question of something concrete being there or not there on the table so much as a question of political will. And if you ask me, Trudeau and the Liberals are probably exactly where they had imagined that they would be end game on this, even going back 6 months. I think they knew that they had the upper hand in terms of what the Prime Minister was calling for was something that most Canadians generally agreed with, which is I'm not going to write a blank check to the provinces unless I get some assurances that I'm going to see improvements in access to doctors, access to nurses, mental health care, all of these things. And although the premiers have huffed and puffed, run expensive billboard campaigns all across the country in this fight, lo and behold, we've sort of seen the premiers plucked off one by one as they've started to say, okay, well, we are willing to negotiate. No more of this no strings attached approach. So I do think that the Prime Minister and his team, who are all pretty well proven capable negotiators, folks like Dominic LeBlanc, the Health Minister Duclos, and even Chrystia Freeland, I think they're pretty primed to go into that meeting on the 7th to support the Prime Minister and get a deal across the finish line.
Gary, from what you've been hearing and listening to from all the vested parties, what do you think the biggest risk is right now, sort of posited against the prospect of it getting across the finish line?
Well, I've spoken with 3 premiers recently on this subject, and of course I've heard the commentaries of Minister LeBlanc and Premier Ford and Premier Legault. Premier Legault was health minister at the time that I was health minister, and the last big time First Ministers met on healthcare was in 2005 with Prime Minister Martin. I was there representing the Alberta government at that time. I think one of the concerns is that it just boils down to money. If it's just about money, then I'm not sure that we'll be able to fix some of the fundamental issues within the healthcare system. And I've heard Premier Ford talk about, the need for, accountability. I don't think anybody's suggesting otherwise, but I've also heard Premier Stephenson say, look, the needs in each and every province are going to be a little bit different. If you look at the dynamics of the population and the size of the populations in certain provinces, it just won't be possible to have the same kind of services in each and every part of the country. So, for example, pediatric cardiac surgery, there's not enough cases to be able to do that in the province of Saskatchewan. So it makes sense, hopefully, that the premiers will also get together and say, look, there are things that we can do in one province on behalf of another province, and we can have some coordination. And we need coordination on the health resources, the human capital, the number of doctors and nurses that are trained in our system to make sure that as we expand, as the demand increases, we'll be able to meet the human capital requirements of doing that.
Melanie, I think as I listen to the federal government, most especially right now, and you would know this having worked, so closely with a political leader, my gut says if you would not be saying this is going to be expedited after February 7th if you didn't really think there was going to be a deal before the budget.
Totally. And I think you can appreciate that you wouldn't put your guy in the room until you thought that there was a deal that was coming. I do think, though, in the meantime, I think it was maybe sending the wrong message to Canadians. It's been over 2 years that the premiers have been asking for the Prime Minister to come to the table. Former Premier Horgan said it out loud, forever, every time he could, and kept mentioning how it was a lack of leadership to come to the table. Now, of course, you don't put your guy at the table until you know that something is coming. So that signals, I think, to most Canadians that something is coming soon. I would say that with this meeting finally on the docket, people will be looking for something to happen quickly because they're tired of the football being passed back and forth between the premiers and the prime minister, for sure.
I've got just about a minute left, Joyce, but last word to you. Do you have any doubt this thing gets across the finish line? I know you've been covering it all week, months actually.
I think it will get across the finish line, but I think there's so many mixed signals. But, to your point about, well, there's finally political will. Hello, really? It just boggles the mind that they're still talking about this when we know this is an emergency, and they're going back and forth on, so what if there's strings attached? Just say yes. Just say, yeah, we're going to spend it on this. What's wrong with transparency? All of a sudden, they don't want to be transparent. It is, think about it for 2 seconds. If Canadians sit back and think about what's going on right now with the back and forth, they're going to go, really? Did we vote for these people? And, are they ever going to fix this?
It feels like all of them kind of read the room, that every Canadian was like, hey, you know what? My kid can't get in for their surgery. This is a problem.
That's the political will. I think it's the political fire under their collective, you know what.
Yeah.